What is real? How do you define real?
You can't jump into cash. Cash is trash. What do? You get out.
Andy Schoonover is the founder and CEO of Crowdhealth, a company that deploys a crowdfunding model to help its users pay medical bills. Andy, welcome to the Bitcoin Matrix podcast. How are you?
I'm doing well. Thanks for having me. Appreciate it.
Yeah, I'm really excited to get into this. I think healthcare has kind of become, for most, maybe a boring and frustrating and annoying subject, but there's a lot of in and outs and to unpack here. So I can't wait to get into it. I have a little bit of a background in healthcare, insurance, reinsurance myself, and I'm a user of healthcare and insurance as well. So yeah,
we'll change that by the end of the podcast. We'll get you converted over.
I've been doing a lot of, I've definitely over my career and both for my family and even running businesses have looked at alternative models, even like sort of HSA and high deductible plans. And
sure.
And I think we can kind of get into all of that. So first, I'd love to hear about you and your background, though. Maybe what you were doing before healthcare or kind of how you got into healthcare.
Yeah, I kind of stumbled into healthcare. I was out of business school at Stanford and was trying to figure out what to do with my life. This was back in 2005, 2006. And, for those who can remember, it was, Silicon Valley was taking off. And the fun story was that between my first year and second year of B school, we actually rented our house to Zuckerberg. So if you've ever seen The Social Network, there's a subplot in that where Eduardo goes and gets, I can't remember, $16,000 or $18,000 to pay for this house so that his buddies could move, from Boston to Silicon Valley, and that house was ours. And so that was just kind of like what was going on in Silicon Valley at that time. And a bunch of my buddies went and worked for Facebook and Google and all these kinds of things. And I thought I'd do something different. So I raised what they called a search fund, which is we went out and raised a little bit of money to find a company to buy. And then we found a company in, of all places, Dayton, Ohio. And so all my buddies laughed at me that we moved from, Silicon Valley to Dayton, Ohio. But so then we raised the equity to buy that company, and it was a medical alert system provider. So it's I've fallen and I can't get up. I'm sure you've seen the commercial. So we bought a competitor to that and converted that company from I've fallen and I can't get up to more of a remote patient monitoring company. So in that little button that they have on that wear around their neck, we put in a Bluetooth device that grabs heart rate and glucose and blood pressure and blood sugar, all kinds of stuff. So we started monitoring folks with chronic conditions and sold that company 7 years later. And that was kind of my first start into healthcare. So I didn't think I was going into healthcare. And after that, I thought I'd never, ever touch healthcare again. But, situations in life, just the God or the universe or whatever you believe in kind of push you in a way of like, this is what you're going to go do. And so here I am back in healthcare with Crowdhealth.
Yeah. A lot there as well to kind of get into. I'd love to go back to maybe the medical device company.
Sure.
And maybe, even there, I think now, like maybe the iWatch has sort of maybe destroyed a product like that. And
yeah, it actually hasn't. The company we sold the company a few years ago, and then it just sold last year for 3 times what we sold it for. So a part of me is like, dang it, we should hold on for a little longer. Another part of me is like, man, it's so cool to get into a company, build a great foundation for which it can grow. We're the folks that we were dealing with were elderly. They're Medicare population. Our average customer was like 83. And so they're not doing a lot of iWatches, and iWatches or iPhone, what do they call them now? Aren't very good at, grabbing blood sugars, and they're still not very good at oxygen levels and weight. They can't do weight. And so, the things that really matter to us in reducing, hospitalizations related to chronic conditions weren't usable by the iWatch. So we still needed some devices in the home to capture that information, especially for folks who are, in their late 70s and 80s.
Yeah, my mom's 80 and she's got an iWatch. She plays around with it. She loves technology. She's a little
I
on the
love
edge
it.
of the curve though,
I love it.
but
I love it.
yeah, it's a lot of fun. So what about also in Stanford? Was this slide at the Facebook house real?
The slide was not real. The slide and the zip line from the chimney into the pool was not real. We did have a pool. I heard, after we came back from the summer, that it was they had a fun time per our neighbors, but there was no zip line, no slide, none of that stuff. I did come back. I will tell you, it's kind of fun. I did come back to a receipt in the trash can that had Mark Zuckerberg's name on it from the Ritz-Carlton in New York. And so I had a buddy who, before business school, worked at Excel, and Excel was the first institutional investor in Facebook. And so I took this receipt and I brought it into him. I was like, "Can you believe that they're spending your money on, the Ritz-Carlton, these things?" And he just looked at me and he just knew, right? He's like, "It's gonna be fine." He knew this thing was gonna be a big deal. But back then you had to have like a .edu email address, and it was only 6 schools or 8 schools or something like that. And so we just didn't even know like how big it could be. And I wish it was the worst financial decision of my entire life not to take that check in Facebook equity. Instead, we took it in cash. So I'm not sure how much that'd be nowadays, but we made a dumb decision back in 2005.
Yeah, I mean, things were so dynamic and things changed so quickly and kind of, I once had a chance to go into Sean Parker's house in New York City.
Oh, really?
That was the sickest house I ever been in, townhouse on 10th Street.
That's great.
But after you sold the medical device company, what was your experience with healthcare after that? Were you involved with the industry? Did you use healthcare?
Yeah, I was, honestly, user of healthcare. My wife and I got married and had some kids and things like that. So definitely used healthcare and used it, fairly well until I was off of my employer's insurance because I sold the company. I rolled off over a couple years. I had a couple years of COBRA, or 18 months, I think, of COBRA. And then I had a decision. I could go to healthcare.gov or, find some other alternative. And so I went to healthcare.gov, and I joke it worked until I had to use it. My little one was having recurring ear infections. And so we went to the ear, nose, and throat doc, who told us that she had a perforated eardrum. So we needed to go and get that worked out at the local hospital. Did that 15-minute procedure, got, the bill, and it was $8,000. And I was like, holy crap, $8,000, for 15 minutes. And then even worse, I got a note from my insurance company saying they wouldn't pay for it. So I was stuck with the bill. And it was at that moment where I was like, man, something's off here. I had enough time in between my last company and this one to really get the juices flowing again for doing something entrepreneurial. And once I got screwed, I was like, okay, my family and I have been uninsured for 2.5 years. And it was like, how do we viably do this without a health insurance? Because I truly believe that health insurance is kind of a pariah on our society. And we can talk more about why I think that's the case, but it's like, how do we do this without health insurance? And that's ultimately what CrowdHealth is going to do.
Yeah, I mean, health insurance, it's definitely a broken industry, in my opinion, as well. It's definitely consuming up too much of household spending. And I don't think we're getting the returns on that spending that we should. At least I think we've seen in other places. And
the stat that I saw recently is like, for the last 30 years, middle class income adjusted for health insurance has not changed in 30 years. So it's flat for 30 years due to healthcare. So it really is kind of sucking out the middle class.
Right.
And in many cases, it's the biggest tax on the middle class. And so, I think there is we can talk about all the reasons why, but I think there's a very viable way to do this, without having health insurance. And in fact, my big vision for our country is to be an insurance-less society. Is to have or at least a health insurance-less society, for everyone to be paying their own healthcare bills, with the help of others. And we can talk about how crowdfunding works within that context. But I truly believe that it's probably better for the country to have to get rid of health insurance.
Yeah, I can see that. And I kind of want to get into that a little bit more here, where I think though, for most, or as an assumption, but I feel like fear around a medical catastrophe and fear around the cost of that in the current system just drives a lot of this model. And I think there's a lot of government capture. So So, even when you go to a doctor, I mean, I have no idea how things are going to cost, and things just seem ridiculously expensive, whether it's a Tylenol at a hospital or an emergency room visit. It just creates so much uncertainty. Whereas when you go to the dentist, it seems like a lot more uniformity, at least now. Maybe that industry is changing maybe rapidly too, but why is there's all uncertainty when you go to the doctor or the hospital? What is driving some of this?
Yeah, I mean, I think it comes to who's the payer, right? In the dental space, it's health insurance or dental insurance is I don't know what percentage of the population, but it's still a pretty small percentage of the population have dental insurance. I think it's sub 30. And so most of us are paying in cash, and so we care what it costs, and therefore we will ask. And as such, we have consumerism, free markets in the dental world. I think also for the cash pay medical world. So let's talk about like LASIX, right? Like LASIX, to get your eyes corrected, is a fairly complex, procedure that has been made doable by some pretty sophisticated technology. And LASIX, 20 years ago, I remember I was in college in 2000, 2001, something like that, where, LASIX was like $8,000. And now I think it's like $1,000 or $1,000 an eye. So it's $2,000. So that's a 75% decrease in a very complex piece of technology over the last 20 years. I know it's gone down 20% in the last 10 years. So, why is cost of LASIX going down like this? Medically complex, yet the cost of healthcare, going like this, right? I mean, it's really because we're not ultimately the payers. We have given agency for our healthcare bills to health insurance plans, right? They are the buyers of healthcare. We aren't, they are. And as the buyers of healthcare, they actually have an incentive for our premiums to go up. This, right? But for your audience, health insurance plans pull in premiums, they pay out claims, this chunk right here, right? The margin is what they can use for administration costs and for profit. And so they actually have an incentive to have you pay more and pay out less. So they have an incentive for your premiums to go up and to deny claims, which, as your agent is a perverse incentive. So we have a principal agent problem. And so, the buyers of healthcare, the health plans, want the price to go up, and the sellers of healthcare, which is these big hospital systems, want the price to go up. And so the price will go up if those two things happen. If both sides of the equation want the price to go up, the price is going up. And so that's what we're seeing in our country. There's no market forces that are pushing those down.
Yeah, exactly. I mean, to recap a little bit there. So let's say, you run an insurance company, you pull in $100 million a year in premiums. You go through your actuarial process. You're hoping to pay out about 96 to 97 million. The rest is that 3 to 4%. That VIG is not big usually, but they're hoping to cover their admin, some profit, and then taking that base though, that 100% in premiums, and running that at some sort of low risk vehicle to maybe get that VIG up, get that rate up to 100 to maybe 103, 104%, maybe make a few extra percentage points. I've worked at insurance companies that have just done so poorly and run at -1%, -2% on their returns. Still, whether they're positive or negative 1% or 2%, it's just, but it's a very interesting business model. But I'm curious where the leverage is in the system then. So if these healthcare systems like Blue Cross, Blue Shield, or United Healthcare, if they're the payer and the buyer of these services, though, who has the leverage in the system?
Yeah, it's interesting, right? I live in Austin, Texas, and we have 2 hospital systems here. And so United Healthcare comes in and says, I want to negotiate with you, hospital system. They're ultimately negotiating against a duopoly. And so, these hospital systems are getting bigger and bigger and bigger, and they're buying out all these, doctors' offices and clinics and things. And so ultimately the hospital systems are the only places in which you can get care. And so even if United Healthcare wanted to reduce the price, they couldn't, because they couldn't lose one of the 2 hospital systems in a major city like Austin, Texas. And most cities have 2 or 3 hospital systems. And so you're battling against, pretty significant forces in that city. So, ultimately just prices are going to go up that way too, because we have consolidation on the hospital system side. So, I think the power is actually oftentimes with the hospital systems. If you are outside the hospital system, you have less power, and therefore the health plans will hammer you. And because they hammer you, then you want to become a part of the hospital system, because you can't viably, survive. And so we just have this, circular thing going on in our healthcare system, where these big hospital systems are getting bigger, bigger, bigger. The prices are going up, and nobody's stopping it. So it's a really difficult thing within healthcare to see these massive players kind of rule the roost. And ultimately it's me and you who are paying the cost of that.
Yeah, and in terms of hospital systems, I've lived in big cities where I never really thought about 1 or 2 or 3 or 4 hospitals. There were just several, it felt like. And now I live in a much smaller city, or on the outskirts of one. And yeah, there's less choice, I guess. Maybe even some cities have less than 2 hospital systems or healthcare plans. So
Sure.
There must be wild swings maybe there in terms of this leverage.
Yeah, I mean, there's studies out there that show as how these hospital systems have consolidated, prices have gone up as a result of that. So if you think about this, right, like hospital systems can go have these really good rates with the health plans, for them, the hospitals, and then they go and buy a doctor's office that has bad rates. And so the doctor's office, once you get acquired, now gets under the contract of the hospital system. So your rates go way up. Right. And that's how the hospital systems are making this money. They're taking low rate doctor business, they're converting it into their contract, which is high rate, and they're making the excess profit off of that. I mean, that's ultimately what's going on in the hospital systems around the country. And you're seeing, like, again, mass consolidations across the country in terms of doctors' offices and things like that. The number 1 owner of doctors right now in the United States is United Healthcare, interestingly. So, you have a health plan who's supposed to be negotiating with doctors for us, but they also own the doctors. Talk about perverse incentives, right? Like, you own both sides of the equation. And so I'm not sure how you can, negotiate in good faith with, people employed by you.
So yeah, what happens to the doctors? And I mean, do they just get squeezed out?
No, I mean, United Healthcare basically says we're going to, give high rates to these doctors, because the doctors, we own them. United Healthcare owns them.
Before they own them, though.
Yeah, they get squeezed out. Well, there is one lawsuit against United right now. And so it's a lawsuit. So it's not, definitive. I don't want to get sued by United, but, where there's doctors groups that are saying, hey, you're coming in and negotiating so low with us that there is no way we can be viable. And so then you're telling us, well, you either take the price or you leave it, right? Or you can sell to us and we'll buy you. Right. So think about you having your number 1 customer coming in. It's just, it's 40 or 50 or 60% of your income. And it says, oh, I'm going to take that 40 or 50%. I'm going to drop it down to 30% of your income, which leaves you in a really awful place. Or if you don't like that deal, why don't you let us buy you? Right.
Right.
Again, that's what some of these doctors groups have issued a lawsuit against United, saying that you're being unfair competitive practices. But they're the 7th largest company on the planet, in terms of revenue. So they are massive. They give a lot of lobbying dollars. They give a lot of political contributions. Like, they're a big, huge behemoth.
Right. There's
yield a lot of power.
Tremendous power. And there's so many angles to this. I remember when I was living in downtown Brooklyn, Long Island College Hospital, it appeared it was getting, bled dry or run into the ground so they could sell it for condos. And the dilemma there was, well, how much further the community would be from a hospital and not have one in the neighborhood. And, and you look at sort of insurance, though, and you mentioned earlier in the show, it works until it doesn't. So I've used healthcare insurance. I've deployed it as a financial officer at a company and gone through and try to maximize plans. I remember specifically, I was at a company where we went from, 3 partners to 20 employees. And so when they had 3 partners, they had the Cadillac plan, and no one was using any of the benefits. And we were going to roll it out to a very young staff. They didn't need the same benefits. We ended up switching it to an HSA. I was able to fully fund everyone's deductible via the company, so that they were fully funded and insured, their premiums and their deductible, so that and the company still saved money on just pure premiums and contributions in that new model. So always kind of looking at ways to sort of squeeze out benefits from the system. I worked at Freelancers Insurance Company. I led the accounting there, and we had a special license to insure freelancers in New York City. And by being able to insure them with not-for-profit funds instead of like hedge fund or private equity money, we didn't have to gouge them. And because we underwrote our plans, we could tweak the plans for our community. So, freelancers in New York City, they don't need a lot of diabetes coverage. They don't get a lot of broken arms compared to like families in Cleveland, but a lot of maybe anti-anxiety meds and depressants and other things. And so we worked with them a lot more mental health. So if you go to healthcare.gov, though, or really any insurance company, between the premiums, the deductibles, but really, like, what is even the odds of them covering my claims?
Yeah, I mean, I think the one thing that's a misconception is that that these plans will cover your bills, right? And in fact, Kaiser Family Foundation came out with something a couple months ago that said 18% of claims from healthcare.gov plans are denied. So you have a 1 in almost 5 chance of your bill being denied. I unfortunately was one of the 5, and it cost me $8,000, and that sucks. Right. And I've been super fortunate, but most Americans they don't have $8,000 sitting around in their bank account. And so we have hundreds of thousands of families going bankrupt each year, even though they have health insurance due to a health event, right? Like they have a health event, they have health insurance, and they're still going bankrupt. Like the whole point of insurance is to, protect you in the case of a big loss. And, health insurance just isn't doing that. And it's a sad state of affairs when you have it, you're paying for it, yet the health plan doesn't step up and do it. So becoming, in addition to denied claims, you've got these huge deductibles where they're, I think healthcare.gov, I could be wrong, I haven't seen the latest numbers, but it's $8,000, $10,000, $12,000, something like that, of deductible for your family before the health insurance plan pays $1. And people aren't paying attention to that, right? And if you don't have $8,000, $10,000, $12,000 in your bank account and you have a health event, that's a problem. If you don't have enough money to cover your deductible, you're not actually buying health insurance, right? You're paying for something that you cannot use. And that's, some education that has to happen in the marketplace from my perspective.
Right. So I think of the 8,000, it's an astronomical number, as you said. I think that would probably bankrupt most families. I think you mentioned that. But I think of it as capped. But what happens, and I don't know what happened with you, but let's say I go to the doctor or something happens and we incur an $80,000 bill or $100,000 bill.
Yeah.
What my assumption, because like I know on little things, I feel like when I go to the doctor and I say, how much is a checkup? They're like, if you have insurance, it's $75, but if you don't, it's $150. So what happens if I end up in the ER, or I have a $100,000 bill? Like, what happens if I don't have insurance?
Yeah. So, without CrowdHealth, you're, I'm going to kind of tell you both sides, because everybody at CrowdHealth is uninsured. We're not insurance. So we have a bunch of uninsured people, and delightfully so. But if you're uninsured and you don't have CrowdHealth, you're kind of stuck, right? You can negotiate that bill. oftentimes if you are, within some level of poverty, they will write off that bill for you. I can't remember exactly what the level is there. But with CrowdHealth, we actually negotiate those bills for you. So there is UCC code, which is Uniform Commercial Code. I think it's code that is shared by all the states. It's not federal code, it's just shared by all the states. That says that if you provide a service and you do not give a price, you have to negotiate. And so we negotiate hard with those hospitals to get those rates down to something that's reasonable. And so we're getting about 60% reductions right now in those hospital bills. So that $100,000 bill would be 40. And that's way easier for us to, it's just, we can crowdfund 40 without a problem. And oftentimes too is they'll extend it out over a period of time. And so it's not even, 40 now, it's like, $4,000 a month for the next 10 months. And so those hospitals will work with you on getting reduced rates if you are uninsured and you're paying in cash. So there's lots of opportunity there.
Yeah, I love the opportunity here. I would love to burn the insurance industry down, or the sort of the healthcare insurance industry down. It seems like there's just tremendous amount of capture. Maybe you could touch a little bit upon, you used the word tax before. How is healthcare insurance like a tax?
Yeah, well, actually, in some states, it's actually fiat, right? It is mandated by the government that you have to have health insurance. And so there's, half a dozen states out there that, California, Massachusetts, New Jersey, DC, Vermont, I believe, and I think there's one or two other ones I can't remember, that it is mandatory that you have health insurance. And then if it's not mandatory, we've been led to believe that we have to have health insurance. So it may not be mandated in law, but it is. We are being wired to believe that we have to have health insurance for our families, or we're being not good stewards of our families. And I just think that's BS. That's baloney. And so that's why I think it's really a tax, is because it's either mandated by the government, or we've been kind of psyoped to think that how you can't do it any other way. You have to have health insurance. I just fundamentally disagree with that.
For sure. And it seems like there's so many perverse incentives in the system that just aren't really helping people get better outcomes. Maybe you could describe instances where it seems like doctors or therapists are kind of pitted against the patients.
Yeah. Well, I think it's I have just tons of respect for the doctors in our country, and a lot of people are pointing at the doctors saying, "Oh, well, you are the ones that are the problem. You're making most of the money, right? It's all the money is going to the doctors." And it's true that our doctors make, twice as much as any other docs across the world. I think it's an average of $290,000 or something a year for docs. There's 1 million docs. So we do the math, it's $290 billion that we're spending on doctors, but we spend $4 trillion on healthcare. So you can kind of do that math. And even if you bump it up to have some really significant benefits, we're talking about, 8% ish of our healthcare costs are going to doctors. And so doctors really aren't the problem. It's mostly these big hospital systems that are sucking out most of the value. There's a stat out there that is bewildering. And I was talking to Marty Bent yesterday. I was on his podcast, and he's like, "There's no way this could be right." And it is. It's 75 to 80% of the bills that you get are wrong, that you get from healthcare, from hospitals,
and not in your favor.
And not in your favor. And so what these hospitals do is they upcharge you. You go into a hospital, you walk into an ER, there's several stages or levels of acuity, and they can bill you based upon what level of acuity you are. And in essence, what that means is like, how bad off are you, right? And so these hospital systems will upcharge to a higher acuity level so that they get paid more. And they do this all the time. I was actually talking to a business school classmate of mine this week, and she said she had a midwife give birth to her daughter, her eldest daughter, and she stumbled upon the bills the other day, and the OBGYN office that employed the midwife, all of her visits, they billed as doctor visits, not midwife visits. And by the way, midwife visits are like half of what doctor visits are. So they double charged her insurance company because they charged her for a doc and not a midwife, right? And so most of these bills have these errors, and you and I, or at least me, I'll speak for myself, when I get these things in the mail, I'm like, this is gibberish to me. Like, I have no idea what this means. And so there's no way for us to expect to go in and type in all the CPT codes and know exactly what they mean. We had another member the other day, or not the other day, it was probably 6 months ago, who got in an ambulance, and they did nothing on the ambulance, but they charged her for like the highest level of triage on that ambulance. Like they didn't even get anything, no liquids into her body or anything, like nothing. And so it was like a $3,500 ambulance ride for 15 miles. Whereas on the lower acuity rate, it was like $1,000, right? And so they're doing this over and over and over and over again and sucking it out of the system. And the insurance companies just kind of go along with it a lot of times. Like I said, they're okay with oftentimes prices going up because then they can charge more. And so it's a whole racket. One other quick thing that I think is important and is, in Obamacare, they actually said you have a maximum of 15% of premiums that you can use for administrative costs and profit. So, if you have $1,000 of premiums, they have to at least use $850 in healthcare costs. So they can make $150, right? So how do you make, and these are all for-profit companies, right? So how do you make 10% more? You have to increase your premium from $1,000 to $1,100 so that you can make $165, right? And so they actually, in many cases, want those prices to go up so they can charge a higher premium so that they can make more money. And it's sick care. It really is sick care where, the more sick you are, the more money that they get from your employer or you or the government, depending upon what the payer system is. And so it's all those things where you're like, man, there's so much perverse incentives, so many perverse incentives in the system that somebody's got to be able to do something to rip out all of that fat. And that's what we're trying to do.
It's brutal. I saw it with my pop when he died in the hospital, and I really think they kind of killed him. But the amount of money that was being spent, like, it was amazing. He wasn't in the Ritz-Carlton. And he couldn't get a nurse when he asked for a nurse to come in when it wasn't scheduled. And it was amazing at the money that was being spent. It was covered by insurance or however it breaks out, but that he didn't have a full-time nurse for that kind of money. And how that system has been so, I don't know what the word for it is, but dehumanized, from just the lighting to people, really kind of, everyone's doing their best. I didn't meet an individual who wasn't trying, but the way the system is built, and I think there was a doctor who came out with a book about this maybe about 10 or 12 years ago, about how systemically it just, being in a hospital is going to increase your risk every day you're there. And and I saw it, the breakdown in communication and things like that.
Yeah, for sure. Well, there's this stat out there that's Dr. Marty McCary, who is a doctor at Johns Hopkins, wrote, a couple of really good healthcare related books. And one of the things he pointed out was, being in the hospital is as risky as being in the Iraq war in the number 1 month of the in the surge, which we had more casualties in the surge than any other point in the Iraq war. It's more risky to be in a hospital than being in a war, because we have so many errors within the hospital systems that are taking people's lives, unfortunately. So we're making errors on the care side, we're making errors on the billing side. It's these hospital admins, and I'm an MBA, so I can say that it's mostly the MBAs. Like, it's the MBAs that are screwing it up, and we have the best doctors on the planet. I mean, it sounds like you're from New York or you lived in New York. Like, there are hospitals in New York that have full levels, full floors to cater to foreign royalty to come and get care at those hospitals. right? So you want to come in the United States. You want to be in the United States if you have a heart attack, if you have colon cancer, if you have breast cancer, if you have all these cancers, like you want to be here because we have the best doctors, the best technology. But how much more do you pay for that? Is it
Right.
twice as much? Because we're paying twice as much per capita than any other country, across the planet. So it really is the insurance companies, from my perspective, that's the payer model that's really broken, that's causing the vast majority of this. So
Yeah. And, the thought there, though, I had in terms of, you come here to deal with all the cancers, but probably being here leads to a lot of cancer as well. I think in terms of the food,
Probably.
the diet, and the
that's
way
a
they
whole nother
administer
situation. Yeah, the food, sure.
healthcare. And you mentioned CPT codes, and I mean that's kind of like a video game. I feel like how many billers are there per doctor in the system to game
Yeah.
the system here?
I took an unofficial survey from a bunch of friends, family members who are doctors, and I think it averages somewhere between 2 to 3 billers per doc, or 2 to 3 admin people, 1 to 2 billers per doc. And so it's a lot. That's a lot of admin costs per doc. And that's in these are all small clinics. I think it's more in hospitals.
Is that freeing up doctors' time to key in on patients?
No, because doctors spend about 30% of their time dealing with health insurance plans. So, you'd imagine, and most of the time that is trying to get things approved, procedures approved. It's sitting there having this little, parrot sitting on your shoulder telling you how to practice medicine. Like, you can't do that. You can't give them that. You can't do that, all because they're trying to, have impact on cost. Like I said earlier, that, they can only make 15%, but they manage around that 15%, right? Like they want to maximize that 15%. So that's where they manage around that. So it's a brutal incentive structure.
Right. And then there's the whiplash that I think everyone doesn't, because you mentioned there's so many mistakes on the bills. They're hiring billers. I think a lot of it's compliance and due diligence, but it's also to help them. These billers make good money if they do a good job of upselling.
Yeah.
I think there's even a lot of upselling and over delivering of health care, I guess, because people don't think the cost is theirs. The doctors aren't taking the cost on, they're pushing it on. They're going to make more. The patient doesn't see it, but it seems like the vicious whiplash, though, is it's leading to a lot of personal debt, though, for families and individuals and bankruptcies. So how did you find Bitcoin, and how did you think to apply Bitcoin to this situation?
Sure. Yeah, man. Maybe the dumbest mistake. I said the Zuckerberg thing was the dumbest mistake, but I got introduced to Bitcoin pretty early. I mean, maybe 2013 or 12 or something like that. And I told my buddy, I was like, man, I'm gonna buy $10,000 worth of Bitcoin, and if it goes down, it goes down to zero, no big deal. But if it goes up, then it's gonna be huge. And I don't forget what it was, but it was in the hundreds of dollars, I believe, back then. And I think it got a ran up. It like went from, I don't know exactly, don't quote me on this, but it was like 200 to 400, and I was like, oh, it's done. It's done. So I didn't do anything with it. And fast forward, here we are at what, 19,000 or something. So I've been interested in Bitcoin. Is that where we're at, 19-ish today?
Yeah.
I've been interested in Bitcoin for a long time. I started in investing in Bitcoin only a couple of years ago. And then I know Jimmy Song. Are you familiar with Jimmy? Yeah, he's here in Austin. He's a friend of mine, and I was having lunch with him, and I was telling him what we were doing at Crowdhealth, and he's like, look, from my perspective, one of the biggest problems with healthcare is that these insurance plans, they have this huge pool of fiat that is melting, 8.5% or something like that last month, right? It is melting as we speak. And so they're going to have to get more capital into the system to pay for this melting fiat. And so he's like, what you should do is you should have people, hold their money in Bitcoin. And so we have allowed our members, instead of, having a centralized pool of fiat, it's a decentralized with Bitcoin and 1,000 different bank accounts. That's actually the ownership of our members, which is kind of a cool change to the way that healthcare is typically been paid for. And so there's just lots of incentives there that get people to act a little bit differently, if you're going to have to sell your Bitcoin to pay for it, right? So it's a pretty cool incentive structure.
Yeah, I love the incentive structure. I think that this Bitcoin changes you. I think healthcare changes you, whether you get good healthcare or not, whether it's available to you. So how does this? One second. So how does the model work? And I'm really curious. So if I join CrowdHealth, I'm joining a community, I'm no longer insured. How do I manage my healthcare bills?
Yeah, sure. So, for the little stuff, I truly believe we need to have a kind of a parallel system, a virtual system, to where we can get healthcare. And so for CrowdHealth, we offer a number of virtual services that are included as a part of your subscription. So if you want a primary care doc, you can log in and talk to a primary care doc, again, as a part of your subscription, no additional cost. If you have an urgent care need, you can log in, talk to a doctor within 15 minutes and, have your urgent care thing figured out. If you want to talk to a specialist, you'll be able to log in and talk to a specialist, within 24 to 48 hours. And so, all the little things we've built into the program to say, you can take care of all the little stuff, for like no or very low cost as you're part of your subscription. So then the question is like, okay, what about the big ones, right? Like everybody's worried about the big ones. And so, for the big ones, what we do is when you contribute your money so anybody that is under 55, it's $175 a month. Families of 4 or greater, it's $695. So you put that $175 into an account. CrowdHealth takes our subscription fee, which is $30. And so then you have 145 left in that account. It's called our crowdfunding account. And then if Cedric has, a broken arm, you would pay the first $500 of that. And, let's say it's $5,000. You pay the first $500 of that. And then the 4,500 is crowdfunded from the rest of the community. So we go and ask 45 people ish, whatever, for $100 or 90 people for $50 or whatever. And then we would, you could say yes to that or no. So if they say yes to that, then that $100 goes from their account to Cedric's account. If they say no, then we just move on to the next person, and we keep going, and we will hopefully be able to crowdfund your $5,000 bill, because you'll have enough money then in that account to pay for that $5,000 bill. So then the question is like, okay, so why would I pay for help voluntarily contribute to Cedric's broken arm? It's not like it's childhood leukemia or something that really like pulls at your heartstrings. Well, when you ask the community for funds, we also show the community how well you've been as a community member. So have you said yes to other people, or have you said no? Right. So if you said yes, and I get that crowdfunding request, I'm gonna be like, yeah, man, Cedric's been a really good member of the community, I'm going to give to him. Right. If you said no, I was like, dude, you're a Scrooge. Like, you're a bad member of the community, I'm not going to give it to you. You're not giving to everybody else. And so there's this reciprocity that drives the engine here, that makes this work. And so far we've had 12 or 1,300, something like that, bills, and they've all gotten crowdfunded on an average of about 3 days. And so this system works. And given that we never touch the money's in your account. It's all voluntary. We're not health insurance. We don't take on any of the risk. The risk is still yours. It's your risk. If the crowd doesn't fund it, you're still with the bill, not us. That keeps us from falling into that insurance trap, which creates a whole bunch of administrative requirements that blows up the model. So that's how it works, and it's worked great. I mean, we've been at this for over a year now. We started last April, so we're 18 months in, and it's worked really, really well. By the way, for big bills and small bills. So we've had brain hemorrhage, that the person's been in the hospital for weeks at a time. We have 2 cancer cases. We have lots of pregnancies. So this can work for small bills or big bills.
Yeah, I love it. There's so much here. I think, though, you mentioned reciprocity and community, and I want to key in on these 2 words. So what have you observed around, historically, what maybe government and the way the healthcare industry is administrated has done to community?
Yeah.
And what have you seen with the community at CrowdHealth versus that?
Yeah, it's a good question. It's like for hundreds of years in this country and thousands of years across the world, right? Like if somebody in our community needed help, we would gather around them and we would help them, whether it be a healthcare, related cost. If, we weren't able to plow the field because we were sick, like we'd have community members come in and help us plow the field so that we could care for our families. Like that community was a huge component of that. And if we got sick, it was the community doctor who would come in to help out, right? And what we've seen over the last 50 years, especially since the 1970s, is the insurance companies are sticking themselves in between us and our neighbor. So we're no longer connected. I'm no longer connected to Cedric, my neighbor, because the insurance company is that buffer. So we don't have any interaction. So, ultimately we're all ending up on little islands, at least in the healthcare side. And I think the government is doing this too, right? Like the government is doing this in the way of saying, hey, we're going to help all the poor. We're going to help all the poor, although the poverty levels have actually gone up in this country. And so that disincentivizes folks like me and you to actually go and help the poor. And so we've actually seeing charitable giving go down in this country as a percentage of GDP, because the government gets involved and they're the ones that take care of it, as opposed to the community takes care of it. I think the folks who are poor in our communities would be a lot better off if it was the community's responsibility and not the government's responsibility to take care of them. And I think the community members would be better off for that too. So we think community is such a huge component. It's one of our core values is community. And we've actually seen people, we have a couple examples where we had a few months ago, we had somebody get their hand caught in a prop of a boat, severed 4 of her fingers. And so we put out that crowdfunding request and we had people respond as like, can I give more? Like, then you asked me, like, can I give more money? Like you would never see that with health insurance, right? You would never be like, oh, the doctor wants $150. Can I give him $175? Like that never happens, right? That's just not going to happen. And we had a miscarriage a couple months ago and people, came in and is like, can we help her? Can we send her flowers? Can we do something for this woman? Because she's a part of our community. And so, we're trying to bring that community back to healthcare, which I think is such a great thing. And even within like the Bitcoin community, like I'm fairly new. I'm two years into being a Bitcoiner. I'm a Bitcoin only guy. So, don't write me any emails. But I love the Bitcoin community because they're so welcoming into the community. When I say, hey, I don't know it all, like I'm still learning, like the overwhelming response is like, yes, like welcome to the crew, like whatever questions you have, feel free to reach out, right? And so there's this idea of a sovereign individual, which I very much believe in, but you're also sovereign individuals within a community, which is super impactful. And I love that. And so we actually have a Bitcoin community where it's Bitcoiners who are, funding each other's expenses. And, that's just a cool kind of thing that we do with Bitcoiners. So, we love the community aspect of this, and, promoting kind of generosity across the country is one of our kind of key, motivators behind doing this, in addition to burning down the healthcare system. Burning down the healthcare system and lift up folks' generosity or their spirit for generosity.
Yeah. So then what are the communities like in terms of, you mentioned a Bitcoin community. What are some of the other communities? How do they form?
Yeah.
How big are they?
Yeah, so we have a couple thousand people who have signed on over the last year. And so we've got kind of a legacy community, and we have a Bitcoin community, and we're about to start a healthcare, or a physical, kind of a physical fitness professional community. So it's like trainers and yogis and things like that through one of our partners. And, so we're going to keep building communities as we go. And how that starts is like the new community is a part of the legacy community until they get to 1,000 members, and then they split off into their own community. So you don't want to be a community of one. So we pair you with an existing community, and then split you off when you have 1,000. So that's what we're going to do. And we want a realtor community and like a gig worker, freelancer community, things like that. Like we're building communities as we go. We're just trying to find where the demand is that we can actually get to 1,000 members, in a fairly easily. So the Bitcoiners and the kind of physical fitness ones are the first two that we're going after. But again, it's all geared towards an affinity group, so that there is a sense of community within that group.
Right. And so that's kind of, I guess, your network in a way. And I guess we blow apart or get rid of the in-network, out-of-network.
Oh yeah, totally.
In traditional healthcare insurance. That's always a very
totally
frustrating aspect of this whole experience.
Yeah.
Maybe you could outline.
I tweeted something the other day, real quick. I tweeted something the other day. A guy went to his OBGYN, or a family went to their OBGYN because they were pregnant. The mom, the wife was pregnant. And the OBGYN says, "I'm in network." He's like, "Great, I want to have my baby with you." And then she's like, "This is the hospital in which I deliver my babies." "Great, we'll go to that hospital." Have their baby. Thank God, baby's great and healthy and all that kind of stuff. They get a bill in the mail that says the hospital was out of network, even though the physician was in network. So they got stuck with a $20,000-some-odd bill. I mean, it's crazy. It's just totally crazy.
This is brutal.
How are we supposed to know this? Like, this is nuts.
That's a whole other aspect of healthcare. I mean, you don't even know what expenses you're incurring along the journey.
And I bet you, 95% of the population had no clue that what the average pregnancy actually costs.
Well, yeah. I mean, most you write it off unless you have one of these nightmare scenarios where the bill comes to you and it's just really some administrative glitch. They're not on the list that you need them to be on. They're out of network, and now you're stuck with the bill or higher deductible or more cost. And and none of this preps people for ownership or responsibility in any aspect of their lives. So we don't get any of the benefits. They're not taking, it doesn't incentivize you to take ownership of your health. I don't even think doctors are truly helping anymore. I shouldn't say that. I think that they're incentivized to medicate and to give consumers and treat the customer as a consumer and give them what they ask for, but not really have, a good dialogue about what might actually help them over the long term.
And if they try to do something that is contrary to the American Heart Association or the whatever your specialty association is then you're opening yourself up to lawsuits, and so it becomes a big, huge group think, where it's nobody can innovate, nobody can try different things, or else they're going to get sued. And so that's why I think these doctors are getting burnt out. And wanting to leave the practice because it's become less fun between insurance companies and getting sued and all this kind of stuff. It's just like, is it even worth it? And that's a shame.
It is a shame. And I think that also is, I think, part of the fiat standard. I think there's just a lot of people who don't like their jobs, are not happy. They don't find them fulfilling. They're not value added. Maybe they realize they're just goosing the numbers on behalf of some other entity. And they're not even partaking, or even if they're partaking at some small rate that maybe doesn't even feel good. I really like
why do they stick with their employers? A lot of times they stick with their employers because their employers are giving them health insurance, right? And so they're handcuffed to their jobs by health insurance. The Rand Corporation came out a couple of years ago and they said they think if there's 4 million Americans that would go do something entrepreneurial if they weren't getting health insurance from their employer, if there was really a viable.
So that's a complete drag on families, on the economy, on just, people might stay in a job in a city they don't want to be in, and they get offered maybe another job at another city, or just even another job, and it's slightly more in money, but they doesn't have the benefits, or their doctor would be out of network.
Totally.
And the administrative nightmare of all this, when you start a new job, going through the rigmarole of applying for the healthcare, even though you're going to get it because you're the employee. But the fact that employers are attached to this whole thing and a part of this dynamic is kind of gross. I just, one, you're attached to your employer. People are sticking with jobs they don't want, but now your employer has sort of access to a lot of information that you don't necessarily want them to have access to, or they're a part of this relationship, or they're determining the quality of your healthcare. I hate that situation. I've never really, I mean, we've been very healthy, very lucky. So we kind of minimize healthcare in the aspect of decision making. But I've seen families go through this where one job A is a little better than job B, but job B comes with the network and the plan they like, and they kind of have to sacrifice. And maybe they have someone in their family that has a really serious condition, and that's not changeable. Or, you hear these situations where, people, they might lose a job, not have insurance for a couple of months, and then they have a condition, and now it's an existing condition, and their new health care won't insure that condition. And the fact that
hard situations.
And it leaves people with these ultimate dilemmas, and that are unfortunate, consume a lot of time, but then also actually take up a lot of time in this administrative part of it. And what I liked, what you mentioned before too, though, is if it must be like $20,000 to $30,000 for a family of four to be insured, and that's
about right. That's about right. Yeah, I mean, especially if you take a look at the deductible. I mean, we talked
maybe if you include the deductible, right? So let's call it $10,000 a year in employee contributions, and $14,000 a year in employer contributions, and a $6,000 deductible, and that doesn't include all the co-pays and everything else. And then you're hoping they accept your claim, and the whole time this insurance company is sitting on this pot of cash, or whatever they then get to invest it in. And sometimes they don't do so well, but that's kind of on them. I mean, there's been some risk-free opportunities out there, so I don't know what they're doing wrong, but most of the time they make 3%, 4%, 5%, 6% on your money. So how is this different in terms of you get rid of the premiums, and the majority of the money stays in your own account? And what happens if you leave CrowdHealth?
You take the money with you. It's yours. So again, that's way different than health insurance, where it gets sucked into the black hole of health insurance land. So the money is yours when you leave. The sats are yours when you leave. We have a $250 exit fee because we have to shut down accounts and all that kind of stuff. But other than that, it's all yours. I mean, we have people with current accounts of like $4,000, sitting in their accounts, because they've been with us for a while, and they've said yes to every single health event, but they've been with us, and right now it's something like 65 or 70 cents of every dollar that you've put in is sitting in your account. So we've only asked you to fund somewhere between 30 and 35%. I don't know what the latest number is, but somewhere in there. And so you still have 65%. And so that's money that would be in the pot of a health insurance plan that's sitting there, right? But now it's with you, it's yours. So you're also actually almost like saving, in addition to, providing, crowdfunding to other people, for their healthcare costs. I mean, it's a pretty incredible thing that you can actually, create value as you're paying your monthly, contribution into an account.
Yeah, I mean, I recognize about 20 years ago, I switched to the HSA high deductible plans because I wanted to lower my premiums to reduce the amount I was paying in, increase my deductible because I wasn't using it. But you can recognize where I kind of see 401ks as a bit of a scam. It traps your money for decades.
A long time, yeah.
Long time, depending on where you are in that system. There's penalties to get your own money back. You got to expose most of your money to risk, or, and so with the HSA plans, let's say you have a deductible of $6,000. After you get enough in the HSA, you can then sort of put it in a 401k like vehicle. again, they're trapping the money in here. You can only use it for medical expenses, and you can put it in this investment vehicle that's going to be trapped till you're 62. And I think we want control over our health back and our money.
Yeah.
And it seems like healthcare is this giant scam. And I love that CrowdHealth is providing tools to not be insured. And I think that what's really important about this conversation, and this reminds me a lot of my conversations with Texas Slim and looking at food and the beef industry, but we want to separate government from health and healthcare from fiat. I think these are very important things. I think that we're not getting served properly here, and they're taking our money any way they can.
I totally agree with that. I mean, I think there's this, triangle of food, money, and healthcare where they're all connected in very vital ways that if we were to figure those things out, we would be able to, get back, America back to flourishing, as opposed to pumping money and creating inflation and all these kinds of things. I think just real quick on food, and I'm on a podcast with Slim tomorrow. I've gotten to know him a little bit, and we've sponsored some of his things, but one of the biggest, there's two reasons why healthcare is really, we pay twice as much on healthcare as the other countries out there. One is our prices are twice as much. So it's just the price of every unit of healthcare is twice as much. But the other interesting thing that this is very much ties into food is we actually consume as a country about the same average number of healthcare units as other countries throughout the world. So we have there's this organization called the OECD, which is the Organization for Economic Cooperation and Development. It's 38 countries across the planet, and most of the continent. So a really good wide array. And so if you look at that and compare what we consume in healthcare and what they consume on average in healthcare, it's about average. We're about average, interestingly. But here's the really interesting fact is we have twice as many obese people who consume twice as much healthcare. And so if we as a whole have average amount of consumption as a nation, yet we have 2 times as much as obese consuming twice as much, that means our non-obese people are actually consuming less healthcare than average across the world, right? And so that is saying something that our folks who are non-obese in this country are actually utilizing healthcare really, really well. And we have a food problem that if we were able to get that obesity down, it's 40%. It was like 15% in 1970. It's now almost 40% obese. If we can get that down to half of that, right, to 20%, which is the average across the world, then we would save somewhere between $600 billion and $1 trillion of healthcare costs. I mean, that's significant.
That's huge.
We spend $4 trillion in total. If we were to reduce it by 600 billion or $1 trillion, I was joking with Marty yesterday. I think we could cut it in half.
I think we're getting jacked.
We probably could. So here's the multiplier, right? We have twice as many obese people. They're using twice as much healthcare, and the healthcare is twice as expensive as other countries across the world, right? So it's that 2 times 2 times 2, right? Like that is a multiplier effect on how our healthcare system is getting really screwed up by pricing and people eating crap. And so that's a real challenge. And Slim and I talk about it, and Marty and I talked about it yesterday. It's just a massive problem in our country that we have 40% of the population being obese.
Well, I mean, we haven't tied in pharma yet. And,
pharma is big too.
Sure. Right. So, I mean, a lot of times pharma solves these problems by not fixing your diet, but allowing you to paper over these issues, which creates more and more expense, which is more and more revenue and profit for the system. And,
so
one thing that
pharma's 10% so it's 400 billion of the 4 trillion, right? But that doesn't count all the externalities of pharma. And the other interesting thing is we pay 2.5 times more per pill than all the other countries. And so in essence, what we are doing is we are subsidizing the R&D for the entire world here in the United States, because we pay 2.5 times more. Right. And so, and the government will refuse to actually negotiate, on behalf of Medicare, which is the biggest payer of healthcare on the planet. So, it's really screwed up. And pharma is the number two, I think, political contributor. And so it's like the system is stacked up against the normal folks.
Yeah, I mean, this is definitely a David versus Goliath battle.
It
You're
is.
taking on, and without getting into sort of the Goliath part there, but like one thing that really perturbs me here is that this notion of insurance and being insured. I feel like if you go into a doctor's office and when you say you're not insured, you almost get the side eye. And I think it's a smart move, it's a savvy move, but it's a cultural thing.
Sure.
And I don't even know maybe if that degrades service to some level, just psychologically. But so what has been the reaction from doctors as CrowdHealth members are coming in force and trying to change this paradigm?
Yeah, if you change the messaging just slightly and not say uninsured, but just say I'm cash pay, doctors love it.
I'm flush.
They love it. And so, just like, look, I'm going to give you a credit card and you're going to get the money right away, as opposed to needing to have to do all the billing and all that crap to get your money from your insurance company. I'm paying you now, with a credit or debit card or whatever, and it's 2%, fees. If you bill insurance, they're going through an electronic health record that's taken 6 to 8% off the top just for billing. You're paying for billing people. You're paying for all of these things. Like, it is way easier to serve somebody who's cash pay than it is somebody with health insurance. And so one of our biggest kind of components of our business is our customer bases in our business is doctors, nurses and docs. I think it's like 10% or something like that of our customers. Somewhere between 5 and 10% of our customers are nurses and docs, because they love it. They love it. They're like, please send me more people, which is great.
Right. I remember when I was, financial officer of a reality television production company, and I switched the plan over, and I was looking at the utilization. It was around 3 to 4%. And the employees were utilizing under 5% of the actual benefits that were available to them throughout the year. It's just complete capture and rigged.
Yeah.
And you mentioned the electronic medical records. And you mentioned, I think they take 6 to 8% off the top just to, and what services, like, this was supposed to be the holy grail of healthcare. They were going to make this universal. Doctors could share records. I mean,
yeah. And I saw something the other day that's like 90% of doctors' offices still have fax machines. And you're like, holy crap, really? Like, it's so ridiculous. It's so ridiculous. Yeah. I mean, it's these EHRs, EMRs were supposed to be, we could share all this information. It would be easy, and it'd be easy to bill and all that kind of stuff. And just none of that came to fruition, unfortunately. So we spent, I don't know what it was, $100 billion or $200 billion of Obamacare or something like that to get these EMRs into every single doctor's office. And it was just a boondoggle for the EMR companies.
I don't know how EMRs might be tied to pricing and maybe the CPT codes, but let's say, I come across some sort of medical condition, and I'm in the Midwest, and my doctor wants $42,000 to deal with that. Can I get that? Will that be more money in New York? Will it be less money in Florida or Texas? And what have you seen there?
Yeah, it definitely depends on where you are in the country. So there's vast differences. I'll give you one little example. We have a member in Wisconsin who had it's called supraventricular tachycardia, SVT. It's basically your heart just beats really, really, really fast, and so they need to do a heart ablation. They stick a tube up there and they burn off a part of your heart. And I'm not a doctor, so I don't know exactly what happens, but the local place in Wisconsin said, hey, it's going to be, I think it was $86,000 to do this procedure. And so he called us and he's like, man, I'm sorry. Like, I know I just started CrowdHealth, but I got an $86,000 bill. And so a quote for this procedure. And we said, can we help you shop for it? And he said, sure. So we found him a doctor in a really great hospital in Chicago, which is 90 miles away. that would do it for $44,000. So 90 miles, you're now saving $40,000. Okay. Not only that, but we found a doctor who does tons of these heart ablations, and in Oklahoma City, that was willing to do it for $22,000. So, what did we do? We flew this guy and his wife first class from Milwaukee to Oklahoma City, put them up in a 4-star hotel for 3 nights. He had his procedure for $22,000. The total bill, including all the travel expenses and everything, was something like $26,000 or $28,000 versus $83,000. So we saved, $55,000 or something like that within 1,000 miles, right? Like, that's how different it is across the country. Wisconsin is one of the most expensive. The Pacific Northwest is really, really expensive. New York City, really expensive. Other places like, Texas and Arizona and some of those types of places are not expensive, are not nearly as expensive. Still expensive, but not nearly as expensive as some of those other. And it has a lot to do with just the consolidation of hospital systems. So in Wisconsin, I think there's like 2 big hospital systems that own all of Wisconsin. North Carolina is very, very similar. And New York is just an expensive place to do business generally, right? So it does matter where you are across the country. Another just crazy thing about our healthcare system is they've got these rules in these states where you can't build a surgery center in the same town as a hospital without the hospital's permission, right? So these surgery centers basically do outpatient procedures. So, it's laparoscopic surgeries, it's knee replacements, hip replacements, things like that. And their cost structure is about a half of what it is at a hospital. So you can get your procedure done for half of what you can get it done for in a hospital. And these states have outlawed these ambulatory surgery centers unless they're approved by the local hospital. What local hospital is going to let a competitor in that has this cost structure of half of what they do? But again, these hospitals have so much power in their local communities that they get away with it. They get away with charging us huge amounts of money and, eliminating competition. It's monopolistic from my perspective.
Yeah, for sure. I'd love to hear maybe then your vision. Where do you see CrowdHealth going, and, how it can impact the industry?
Yeah, I mean, I think that my vision is an insurance-less society. Like I said, I really believe that we can do this without health insurance. I think it benefits everyone. I do not want us to go to a federalized, healthcare system. I think the government should not be in our healthcare business. And I think hospitals can have cost structures that can allow them to operate at a significant, discount to what they're currently operating at. There's this Will and Kate, Prince William of whatever, in Kate, in UK, who I'm talking about. They had their last baby a couple of years ago, I think it was. And they had their baby in like the Ritz-Carlton of hospitals within London, right? This is London. Like, this is not an inexpensive place to do business. And it was $9,000 for them to deliver their baby. The average in the United States is 14, right? So Prince William and Kate had it for I think it was $9,350. And an average in the United States is 14. You can't tell me that you can't operate, similarly to, how a hospital functions in the UK. And the UK actually has better, fewer error rates than hospitals in the United States. So there's something screwed up here with their cost structure. They have to figure it out. Everybody gets super excited about, a new hospital getting, built in their town. Guess what? You're paying for that. Like, it's coming out of your insurance premiums. Like, you're paying for that new building, right? And so that's what's bewildering to me. The other crazy thing about this is they do these big capital campaigns to pay for this new building in which they're going to gouge you. I mean, it's like something out of 1984, right? It's like, doesn't make any sense. I hope people understand that if you're giving to capital campaigns of hospitals, They are building buildings in which they then will use that building to charge you an egregious amount of money for the services that they pay in that building, and you now have just allowed them to do that. Like, that makes no sense to me.
Right.
You know, if that makes sense to any of your listeners, please, my Twitter is Andy or Schoonover Andy. Send me money because I need a new lake house. Like, you know, it's silly.
Do you see more holistic medicine from at least maybe the Bitcoin community, or desired?
For sure. You know, holistic, naturopathic, integrative medicine, for sure. I mean, we have this crazy stat where, as of a few weeks ago, I don't know what the stat is now, but as of a few weeks ago, we had 15 pregnancies in our community. And well, first I'll let you guess how many generally across the United States have midwives? Like, what percentage of people do at home births?
I'd say very low.
Very low. It's like 6 or 7%.
Yep.
In our community, we have 15 people who are pregnant. 11 of them are having home births. Like, that's the group of people that we have. Like, they are anti-Western medicine, and we support that. Like, we're like, man, the thing I love about the Bitcoin community is they're curious. Like, they're curious about some alternative stuff. They're curious about, you know, what their doctor tells them. And I love that curiosity, and they're opting, after doing their research, to do other stuff, you know. You know, I currently had my labs done, and I have super high LDL cholesterol. LDL is the bad stuff, the bad cholesterol. I was telling Marty, you know, I saw this study the other day that 77%. So LDL cholesterol is supposed to be sticking to your arteries. It's supposed to, you know, ultimately create plaque, rupture them, all this stuff. Okay, that's what the doctors say, American Heart Association. A recent study came out that said 77% of people who had heart attacks didn't have a high LDL. So you can conclude one of two things. One is, maybe LDL is not what causes heart attacks, or, and this is what the authors of the article wrote, the threshold for high LDL should be lowered, right? So instead of 100, it should be at 70, right? And so what does that mean? You have a whole bunch more people on statins. The pharmaceutical industry. Statins are probably the most profitable pharmaceutical ever created. And a lot of people over the age of 50 are on statins. And so, you know, like, I don't know what I'm going to do, what I'm going to decide, but, you know, it's like, at least be curious and look at the data and look at the research. And we're all about that. You know, you should, don't just take what your doctor says as gold, the gold standard. You know, you're already in Bitcoin. You don't believe in the gold standard.
I think most people direct their doctor these days. They, you know,
I saw something on TV. Like, can you give me that? Like,
yeah, exactly. I mean, there's so much regard for the doctors, and I love the doctors. I mean, they're trying to help, but like, they spent 4 minutes on whatever topic that you're bringing into them. And quite honestly, there's sort of like the historical bias of what they've seen and what they've solved or helped. That's what they're going to then deploy. So if they see something similar, they're going to assume it's what they've already seen, per se. So that's why, like, most people, I think, nowadays are able to go online, even if it's not a great website, find out some information, look up their symptoms, figure out what they think they have, and go into the doctor. I love this. You go to the doc, I think I have this. They're like, oh, what are your symptoms? This, let me look. And then they're like, yeah, you're right. I think you have that. And then you're like, okay, so when I have this doc, I usually, my other doc gave me this. And they're like, okay, I'll give you that. Sounds good. Sure. And like, you can be bullshitting the whole time. I mean, you know, and the amount of time they spend with you, I mean, it's so reduced. You know, I thought it was getting, in that regard, it's more efficient. Like, hey, I'm going to tell you what I want. You wouldn't take it over the phone. I'm going to get out of here in 5 minutes. But I'm like, really? You're going to spend 4.5 minutes agreeing with me?
Well, you spend, you know, 5 to 10 times longer in the waiting room just waiting on the doc. You're talking to the doc. Like, look.
Well, that was the old joke. I mean,
yeah. Well, here's the cool thing with Crowdhealth, and this is what I did. Right? Is like, I jumped on my virtual primary care. I talked to the guy for 4 minutes. I said, I want labs. Like, I just want a whole panel of labs so I can see what's going on. And he's like, great, here it is. So I got a whole panel of labs. I go to the local lab, and the whole panel of labs. Well, first off, I was like, you know what? I have a lab down the road, like it's a half a mile from me. Like, why don't I just go there? Like, it's easier, right? And I priced it out as $435 to do my labs. And I was like, ooh, that sounds like a lot. Like, maybe I should actually call CrowdHealth. I am the CEO. I probably should act in like really good behavior. So I'll call CrowdHealth and see what the labs are. The same labs were $44. $44. The health insurance plan would have paid $735 for those labs. I paid $44, right? I got $44, and now I know everything that's going on with my body, right? I have high LDL. I got to figure out what that is. My potassium's a little high. I got to figure out that's going on with that. But like, I have now like a scorecard of what's going on with my body for $44, and then I can go and say, okay, let me do some research. Like, why are these things moving around? And a little bit more self-directed, and then you can talk to a doc. I mean, I talked to a doc at CrowdHealth, a specialist. I said, here are the things I'm really concerned about. What are your thoughts on it? And I just, tapped the button on CrowdHealth. I talked to a specialist within 24 hours, and she told me what she thought. And it's like, it was self-directed healthcare, but now I know what's going on in my body.
What I love about this is it's run your own numbers, run the numbers, but you're incentivized to run the numbers on your own health, like actual, vital signs, versus running the numbers on what like things cost and CPT codes.
Totally.
And and I'm saying, like, especially like when we get to the final step where we eliminate some of the rigmarole, but like when you could focus just on the health numbers and not the financial component and all the stress and friction that comes with this. It's
By the way, that entire series of events cost me nothing. I mean, it's all included in my subscription. All that stuff was included, right? So it cost me nothing. And now I know what's going on with my body. Like, that's a pretty cool thing that I couldn't do with health insurance. The only thing I had to do is get up and go to the lab, and that was a pain in the butt. Like, I hate going to the labs, but ultimately what we're trying to do is create a direct to consumer experience where, the phlebotomist can actually come to your house for an extra $50, right? So you can actually sit there, watch your ESPN or whatever, and get your blood drawn, and then 24 hours later it pops up in your email. There's your scorecard of your, all of us who run businesses, we have scorecards. Yet nobody knows what their scorecard is for their body other than weight, basically. Right. And so I'm all about it. I'm all about everybody knowing exactly what's going on with their body.
I think that's the other thing I'm sorry, I didn't mean to cut you off.
No, here's one other crazy thing in our government getting involved in this stuff is there are 24 states in which you can't go to a lab and get your blood drawn and have them tell you what's going on with your body without a doctor's permission. Like, a doctor has to permit you to go and figure out what's going on with your body. These are state rules. I mean, it's ludicrous that I can't figure out what's going on with my body without a doctor saying, okay, you can go check it out, right? Like, it's all this silliness.
Yeah. I think I see sort of the same sort of flavor in, you can't get coordinated healthcare. It's very hard to get a doctor who knows everything going on in your life with maybe you're different if you have varying medical issues. I've been lucky I don't have that need, but I mean, my father, my mother, they got different things going on, and each doctor sort of specializes, kind of goes very deep, but it's hard to find a family doctor who has the time and the inclination to really get to know the patients, because they're not incentivized to kind of follow things that are going on outside of their office that someone else is getting paid for.
Yeah.
To spend the time with you for your long-term benefit.
Totally.
And I compound that with, the amount of time it takes to go to the doctor's office. And then, the old joke is, I mean, you're spending there like the half hour, the hour waiting. You can't do that to them. My wife went to the doctor. She got there like on time the other day, and that was too late. And they wouldn't take her that day. And it's just, it's run more like a commodity and like a movie theater than, at the personal level.
It's not a direct to consumer experience, right? Like, it's none of these experiences would be, an Apple experience, right? They're all hospital, insurance company, business to business experiences with just the patient being a cog in the system, really, right? In reality, like the patient should be the center of it. We should be the center of this, and everything should be revolving around us. But instead, the hospitals and the insurance companies are the center, and we have to figure out how to deal with them, right? That's not what we're trying to introduce to an awesome direct to consumer experience in healthcare, and that's ultimately what I think is going to win.
And I think if I get at the beginning of every enrollment period if I have an employer at the time, I try to game out like, do you go on the high deductible? Do you think
sure.
Maybe this is the year we're going to have the pregnancy?
Look at the crystal ball, like what's going to happen this year
right.
to figure it out. Yeah.
But if I always know, like, it's the whole, look, we're not going to use any of this, but we should have it just in case. Yeah. And at the end of the day, I mean, we've probably spent a few $100,000 on healthcare between me and employers.
Yeah. Yeah.
And wow, like, I don't think I've used, a quarter of that.
Right. Well, the probability of any of us having a really significant health event is really, really low, especially if you're in your, 30s to 50s. The probabilities of that don't start going up significantly until you get into your 60s and your 70s. And so, most of us are not going to going to have big health events. And in fact, what we're doing is we're subsidizing, those who do. And most of the time, those who do, 70 to 80% of chronic conditions are preventable. And so, most of the time we're subsidizing folks who are not taking care of themselves, who are not taking personal responsibility. There's genetics and things like that too. And I have empathy for those. Like I have some genetic stuff in my family, so I get it. And there should be a safety net for some of those people who have genetic disorders, but like, we've got to figure out a way to incentivize people to, eat better and work out and keep from, smoking, 2 packs a day.
Right.
It destroys your body.
I think that's, well, yeah. I mean, there's a lot of those issues in society. And I think, but 20 years ago, there was a little girl who fell down a well and the whole country watched the television praying and hoping for this girl, whatever word you want to use, whatever, and wishing their best on the family. And they just wanted it to be an accident. And we got through this as a community. It felt like a country as a community. And, I mean, the most egregious example is this, 5 years ago, an alligator ate a little baby down by Florida, Disney World. And the whole country tore that family apart. And
how could you let your kid get that close and all that kind of stuff?
You're right. It went from accidents happen and we want to get through this to, if an accident happens, then it's your fault. And you did. And I think that's where like healthcare is in terms of, that's what I'm getting at. It's like, if you have, whether it's genetics or a bus hits you, or you go over a bad sidewalk and fall off your bike, and if you're not insured and you get washed out, it's like a sin on the person. Without even getting like a religious way, like this person made and we're not in this place where we take care of each other, and things are sort of like more reasonable. I mean, in a lot of ways, what we're getting at with the healthcare and the doctors, I mean, they spend a lot of time going to school, but I think the egregious cost of their insurance, their malpractice insurance is I think really driving a lot here too. And all the capture in the system that they're not able to provide
is ridiculous.
They're not incentivized in any way to give the best optimal healthcare. They can't do what they want to do. They can't be doctors.
Yeah. Totally.
And so I'm really excited for tools like Crowdhealth. I want to blow the whole thing up. It's just
blow it up or burn it down. Either one's fine with us.
And I'm glad someone's finally taking a bazooka full of Bitcoin and just pointing it at the health insurance industry.
I love it.
Because I mean, we all want healthcare. We all want these services when we need them. No one wants to go to a hospital, but you need it when you have to go, and you should hopefully get out as soon as you can. But so I'm super psyched.
Oh, appreciate it.
I've enjoyed this conversation immensely. I think it's an important one. I'm like I said, I'm really excited to see Bitcoin shining a light on this vertical.
Yeah.
So I'll leave it to you for, any parting words and to let people know where they can find you and CrowdHealth.
Yeah. So, like the next few months is open enrollment. I think 80% of the Americans are making decisions on their healthcare over the next 2 months, 2 or 3 months. And all I would say is before you go to healthcare.gov, please take a look at what we have to offer, because I think it's so much better and offers so much more freedom than healthcare.gov. Even if you have an employer plan, opt out of your employer plan. Ultimately what we want to do is we want to create something so cool that people are saying, I don't want my employer plan. I will opt out into something that's different. And a lot of times our monthly contributions are lower than what's coming out of your paycheck, and you don't have those big, huge deductibles. So go to joincrowdhealth.com and come and see us. Give us a try. We'd love for you to join the community. I believe we have a promo code for you too, which is Matrix.
Yep. And it's $99 a month for individuals to join up.
$99 a month for 6 months. I mean, $99 for 6 months, right? You get access to primary care doc, urgent care, labs, all these kinds of things for $99 a month. Give it a shot. If you don't like it, then fine. You take whatever money's left in your account when you leave. If you like it, then stick with us and join us on the mission to change healthcare.
Yeah, I mean, within probably 12 months, any individual would probably be saving and self-insuring a whole deductible at that point, and probably covering, I would say probably 65. I'm making these numbers up. 80% of most incidences. Yeah, and then talk about over years. I mean, I love this model, and I think it's a way to kind of claim a lot of your life back. And I think it sort of drives communities towards, or not sort of, it really drives communities to take, as individuals, but as communities, more ownership of and personal responsibility of their own outcomes.
And you're stacking sats along the way, which is probably the best part.
Yeah, amen. So
cool.
This has been so dope. Thank you so much, Andy.
Thank you for the invite. Really appreciate it.